Hey guys, welcome to the Metabolic Health Docs YouTube channel. And I wanted to touch on a subject that I think will resonate with you. And it resonates with me because my wife has type 1 diabetes. And because of her diagnosis, it creates a lot of stress in her life. And it reminded me of this term I learned about from today's guest, which is Dr. Roshani Sanhani. And that term is diabetes distress. So I want Dr. Sanghani to share what that is and why it's so important that you understand it, because there's so many people who, when they understand this term, will better be able to deal with their diabetes. So, Dr. Sanghani, thank you for sharing your perspective on this topic, and tell my audience what they need to know about diabetes distress.
Thank you, Tony. So, the concept was that there's something called diabetes distress, which kind of acknowledges that living with diabetes, which is a long term chronic condition that tends to be with you for years, it's not a short term, it's not a fever, a flu, a viral infection that's gone. This is with you day in and day out, every day. From the moment you wake up, you have to make decisions thinking about diabetes. And this is more so for people with type 1, but it's also very much for people with type 2. So it applies across the board of living with diabetes. It's not depression, it's not anxiety, it's the emotional, psychological, and behavioral burden of I have to check my glucose, I have to watch what I eat, I have to get in my steps, I have to meet the doctor, I've got to do blood tests, take medications. People are not supporting me. I can't find the food that I want. I feel like a failure. I feel like diabetes is going to get the best of me no matter, even if I try my best, it won't be good enough. It won't be good enough. And this can wear you down. Now, we're in San Diego. That's the headquarters of the Behavioral Diabetes Institute. And I went and met them. I snuck out from this conference and met the founder, Bill Polonsky, a PhD, and dedicated his career to diabetes and behavior change. And he and Dr. Fisher have basically created measurement scales. So it's one thing to tell your friend, I'm stressed. And then your friend will like hold your hand and look you in the eye and say, I'm here for you. How does a patient with diabetes distress get this understanding from their healthcare provider? Dr. Polonsky and Fisher made a scale. It's called the Diabetes Distress Scale. They had the first version, they've come out with a new one. There are different ones for type 1, type 2, fear of hypoglycemia, being a parent or a spouse of someone with type 2, because there is burden, there is worry, you're concerned about your well-being. It comes from a good place, but it can turn into negative emotions. And what the science has shown is the higher the burden, the worse the HbA1c, the worse the ability to manage your habits, your exercise, your food. So we need to bring this diabetes distress down.
Thanks, Docs, for sharing your perspective. I hope it really provides a path for people to understand that what they are living with can cause stress and there's a way to overcome it. I had a chance to record this video while at the Symposium for Metabolic Health in San Diego in 2024 in the summer, and I'm really excited that I get a chance to bring, thoughtful leaders like Dr. Sanghani to you on my channel. So I really appreciate you guys. I hope the video added value. And until the next video from the Metabolic Health Doc, continue to be safe, be well, and continue to protect your nest.